Okay, I think we'll probably get started at 12:32 just because we have a lot to chat about. Does that sound good to folks? Perfect. Okay. Yeah, so I think we can get started. Welcome everyone. Folks can trickle in. Um, This is supposed to be a very fun, interactive event, so it's okay if you have to like be off camera and do what you need to do to take care of yourself. But we're really excited that everyone's here. Welcome to LA Climate Week. We are one of the virtual events. We're talking about climate health, clean energy, and environmental justice. And the three presenters who we'll introduce shortly are part of Climate Health Now, which is an organization of healthcare professionals across California advocating for climate health. Next slide, please, Whitney. So I'm Amanda Dalmeda. I use she, her pronouns. I'm a community medicine fellow and family medicine physician at UCLA. And grateful to be here with everyone. Kevin, go ahead.
Hi everyone, my name is Kevin Briseno. I use he, him pronouns. I currently go to UCLA as a second year studying physiological and environmental science. Mayukha.
Thank you, Kevin. Hi, everyone. My name is Mayukha, and I'm also UCLA undergraduate studying biology and environmental science, and so excited to meet all of you. So briefly getting into the agenda, we're going to first start off with introductions to get to know everyone better, and then we'll kind of go over the current political moment, both nationally and locally, and how we can move forward. And our main agenda will be understanding the immediate health benefits of clean energy, for example, clean renewable electricity, climate smart buildings and homes, as well as clean and active transit. And then we'll kind of go over shifting energy consumption and then also go over advocacy and opportunities for advocacy action. And we hope that you can take away a better understanding of how climate is connected to health and also take part in a brief, impactful advocacy action in the future.
Perfect. Thank you, Mayuka. So because we are talking about environment and climate in Los Angeles, it's important to acknowledge that the land that most of us are settlers on. So this land acknowledgement is from Los Angeles Unified School District. I've been to Curravunga Springs a couple of times. Not sure if anyone's visited there. It's just beautiful, and so I highly recommend it. But someone who is Tongva and leads that organization had recommended me this land acknowledgement because they said it's the most comprehensive and thorough that they've come across. So we are on unceded and ancestral land of the Gabrielino, Tongva, and Fernandino Tatavian people. And please correct me if I'm wrong. I tried my best. And next slide, please. And so if everyone, whatever you feel comfortable doing in the chat, if you can introduce yourself with names, pronouns, relationship to the health community, if applicable, this is an open and welcome space. And so if you're not part of the health community directly, that's totally fine. And if you're just passionate about the intersection of climate and health, welcome. And we're really happy that you're here too. And then where you're joining in from, so zip code, and then what inspired you to be interested in climate health? Like what brings you here today? And throughout the conversation too, feel free to just like put in questions in the chat or comments, and we can be fielding that as well. Okay, next slide, please. So just a bit about Climate Health Now. Our vision is to organize and activate the California health community to advocate for equitable systems level climate action to achieve health for all. And so we define the health community broadly. There's a lot of different folks who are part of our community with a diversity of experiences. We have over 970 health community members throughout California. And go ahead, Mayuka. Next slide.
So when we're currently talking about how climate health and environmental justice can intersect, it's important to first talk about the politics that are currently undergoing both at the national and local level in LA. So you can see at the national level, there's lots of declining democracy, as well as systematic dismantling U.S. climate policy, which includes the most recent repealment of the endangerment finding in February 2026, my apologies, which dismantles and undermines legal mechanisms in order to fight and against environmental injustices, as well as dismantling of lots of different justice and climate offices, as well as the federal freeze of clean energy funding and permitting halts. You can see at the local level as well is that there's unequal investment in communities throughout LA County. Some communities may earn a better, let's say, more investments from the local government than other communities that may see disparities within our communities, as well as there's lots of different rising costs and economic tensions due to the tensions around the world right now, as well as LA County is currently implementing 2045 Climate Action Plan in order to address these at the local level.
Okay. And so just to give a little bit of a context of where we are, as you can see, our energy consumption is increasing at the same time as global temperatures is increasing, and the United States leads in consumption. Our current economic system requires infinite growth on a finite planet. So even though the primary sources you can see in the graph featured there is fossil fuels, our energy consumption in general has been increasing in relationship to global temperature changes. So it's really important for us to make the switch to renewable energy and at the same time reduce per capita consumption in order to live within the planetary boundaries. So today specifically, we'll be talking about the importance of transition to renewable energies to achieve global climate goals and improve human health. And then something that we also want to highlight while we make this transition is a just transition, what we'll get into a little bit in the future slides as well. Next slide, please. And so we'll go talk a little bit about a global level, and because this is LA Climate Week, we'll then go to the local level. So there's a disproportionate impact to communities across the globe. So as you can see here, the countries that are most vulnerable amid climate change are also the countries that emit the least amount of carbon dioxide. And you can see that at the local level as well. Next slide, please.
And when we're talking a bit about the impacts of climate change on human health, it's kind of important to make the distinction between environmental justice and climate justice. Environmental justice can be seen at the local level with an unequal burden to exposure from things like redlining and the acute immediate health impacts that can come and arise from pollution in their environment. But climate health can be more generalized as long-term impacts that can be seen in things like climate justice, where it unequally impacts on folks who may not be emitting as much as compared to other countries. And some of the impacts as listed on the slide include extreme heat with illness and death related to heat, related to those things in heat, drought, degradation of the environment, which can include environmental justices, as well as food system impacts from the worsening climate, as well as severe weather and floods, as well as worsening air quality, air and water quality, from algal blooms, bacterial infections, and other sorts of ailments.
Okay, and so to get to know each other in the room a little bit, we were hoping to, how many folks do we have in here, Whitney? Yeah, we were hoping to break out into small breakout rooms just for a couple of minutes. And what we wanted y'all to chat about is what are some of the ways that climate change impacts health? And have you observed any of these health impacts in your community? And or if you're just interested in like, okay, how is climate directly impacting health? Like what questions specifically do you have and like what drew you here? So for just a couple of minutes, we'll join breakout rooms and then you can discuss amongst yourself just to learn some of our community members and then we'll come back and then have a couple of folks share out and then we can continue on.
Great. And we have 20 people in the room, so we're going to do around 5 breakout rooms.
Perfect. Perfect. Thanks, Whitney. Welcome back, everyone. I hope y'all had some good conversations. Does anyone want to share what y'all spoke about or what came up for you in the group? Just like a overview, a little highlight reel. Allison, would you like to share?
Yeah. Hi, everyone. My name's Allison. I work for the Office of Environmental Justice and Climate Health with the LA County Public Health Department. So if you're not aware of us, we do exist in LA County Public Health. Um, and we work on a lot of different climate health um, just impacts. And so I'm distracted by one of my cats just chewing on something and off camera. We do a lot on like extreme heat. Also we've talked a lot in our group with Cindy on the wildfires and the impact on the LA wildfires. Even still, there's so much health impacts that we don't know. And our office has done a lot of blood lead testing, soil lead testing, and have done that kind of for the past year now. And yeah, if you're interested in us as an organization, please reach out.
Thank you, Allison. Yeah, I'm sure that folks on this call have experienced the fire and some of the health impacts. I work with some community clinics that within like 2 days of the fires, because they're under-resourced and underserved populations, they actually like ran out of inhalers within 2 days and couldn't provide inhalers to their communities. And a lot of folks had underlying respiratory diseases. So that's definitely like a direct, immediate impact that we saw in our patients. Um, okay, perfect. Whitney, do we have time for one more or should we continue on? Okay, I think we can keep going. If
Sorry
anyone
about
else
that.
has,
I couldn't
oh
find my
no.
unmute. I think, yeah, we should probably keep going.
Okay, perfect. If anyone else has thoughts and comments that you want to share in the chat, feel free to do so as we continue with our slides. Awesome. Thanks, Whitney.
All right. Thanks, Amanda and Whitney. Appreciate the facilitation of the discussion. Now we're moving on to the environmental justice component of this presentation. When we're looking at unequal burden in communities, we can see that LA already has a huge amount of legacy when it comes to oil drilling, which started in the 1890s. With over 5,000 active wells, even one third of all residents of LA County live within a mile of an active or idle oil well, which can come up as different environmental pollutants, including black carbon, PM2.5, and different emissions that can affect environmental justice as a whole. And when we're looking at the disproportionate impacts, we can see that most people that live near the oil wells are people of color. And could you move to the next slide, please? Oh, thought there was another slide there. But yeah, 42% of those live between 200% below the federal poverty line, which really goes to show how disproportionate these oil wells can be near certain populations, with more than 9 out of 10 of them who live near oil and gas wells are communities of color. And with lots of disproportionate health impacts, you can see lower lung function, higher blood pressure reported, as well as higher reported preterm birth rates, which appears and within those communities of color. And since this is such a disproportionate impact, I'd also like to talk about my own experience with environmental injustices. So Whitney, the next slide, please. So I'm originally from San Bernardino, one of the places that holds a lot of logistics for the rest of the US. The Inland Empire is kind of known as the logistics capital of California, but with primarily low-income Hispanic, Latino, and Black communities, this can show up as different environmental injustices, with many of the warehouses built next to communities, and me personally living next to an intermodal facility housing trains, freight trucks, and logistics facilities that inherently emitted lots of pollution in my home. And even though there was a park built right next to one of those intermodal facilities, that combined with the trucks driving by while kids were playing in their Little League baseball teams, could really show that environmental justices do exist, and kind of started my catalyst as environmental justice advocate. And so these disproportionate impacts are directly environmental justices that really affect people of color first and worst. And now as I transition from San Bernardino to LA and working in these spaces, I'm able to learn and grow in environmental justice space here to take it back to San Bernardino to work against these injustices back in San Bernardino.
Thank you, Kevin. And with that overview, we can kind of shift to talk about how clean energy specifically can benefit health and address environmental justice. So, kind of talking about the immediate health benefits of clean, renewable electricity. So, first, shifting to clean, renewable energy, for example, solar, wind, or geothermal, can rapidly help us clean our air and water. And they also produce immediate health benefits in the form of reduced illness, reduced healthcare costs, and also less early deaths. A great example is the removal of the Shenango Works plant on Neville Island, where we saw immediate health benefits and improved respiratory wellness in a lot of the residents in the area. And also, we're seeing how locally big solar panels, such as the one at UCLA, were discreetly placed and actually have the capacity to power 20 homes manually. And they've shown that we can actually subtract costs and then also yield a downshift in electrical grid dependence. And looking at this nationally, a clean energy standard that achieves about 80% of carbon-free power by 2030 can actually save us an estimated 317,500 lives in the United States over the next 30 years. And globally, we can see that about 153 million premature deaths linked to air pollution could be avoided if governments, such as the United States, speed up their timetable for reducing fossil fuel emissions. And another thing we wanted to, oh, sorry, go ahead.
Oh, you're all good. So as we go throughout these slides, you'll see some windows saying related to the Green New Deal that the LA City is planning to implement, which includes a couple of goals like clean, healthy buildings, as well as renewable energy. So in this slide especially, you can see that new buildings will have net zero carbon by 2030 as a goal apart from the Green New Deal that LA is trying to implement. So you'll see that in some of the health benefits that can come from climate smart buildings and homes can be adopting reduced energy efficiency practices, reducing the need for additional energy use, and the construction of more power plants and other environmental justices that can come apart from that. And then also replacing gas stoves with induction stoves, which are electric ones, eliminates indoor air pollution from the methane that's used to power these the incumbent stoves, and reduces the outdoor air pollution nearby the homes as well. Next slide, please. And then another immediate health benefit that we can find from these climate smart buildings, you'll see that most of our time is spent indoors, and then using the smart systems that we can implement into these buildings, including HVAC, using natural light, and transitioning away from these gas stoves, as well as using heat pumps. While they may be a little bit more expensive, can be an investment for our health overall. They contribute these sorts of things that we eliminate, can eliminate up to 13% of greenhouse gas emissions, and the improved indoor air quality can save up to 6 to 14 billion from reduced respiratory disease, as well as 1 to 4 billion from reduced allergies and asthmatic symptoms. And so sometimes it's cited that asthma sometimes comes as a result from windows, and if we improve our HVAC systems and make them more efficiently geared towards climate smart mentality, we're able to efficiently reduce those health impacts that we receive indirectly from the homes and buildings that we live in.
Yes, and so we're highlighting just three of the health benefits, but there's a lot of other transitions and implementations that we can have. But I'm going to be talking about transportation, especially like air pollution from transportation. Um, so big picture, I'll look at the harms of air pollution, then we'll talk about the ways to transition to clean transport, and then we'll talk about like the health benefits from having clean transportation. So air pollution is an environmental justice issue in LA. I know that Cindy was already chatting about it in the chat. So there was a study in LA showing that the most disadvantaged neighborhoods were exposed to both the most toxic particles and the highest particle concentrations, and 25% of communities facing the most socioeconomic disadvantages experienced greater amount of pollution and more toxic pollution. And 63% of the pollution came from vehicles. And as you can see in the images on the right, the bottom one is redlining practices within LA. And then the one on top is air pollution exposure. So you can see that if you overlay them, the communities that were most redlined face the most toxic air. And next slide, please. So similar to the previous slide, as you can see, systemic racist policies and practices has deprived some communities equal access to public transportation, vehicles due to discriminatory lending practices, and unequal exposure due to housing discrimination. So how can we transition to clean and active transportation? I moved to LA from New Orleans, and I was biking around New Orleans. And as I came to LA, when I was asking like, oh, can I bike around places? Folks kind of laughed in my face because we don't have really accessible bike lanes. We don't have a perfect public transportation system. I know that we're working on it. So these are things that LA County and LA City in general can improve on. So we definitely need to start reforming transportation systems to reduce vehicle emissions. Length and frequency of trips, especially as we saw that 63% of the air pollution is caused by vehicles that folks are exposed to. And I've seen just like a lot of exacerbations of asthma, COPD, other respiratory conditions within the clinic. Center equitable access to healthier, low carbon, and physically active choices. And then it's also important to note, especially as a physician, I can tell people to run or walk or bike to the grocery store, to work, to school, et cetera. But if we don't have safe places for people to do this, and it's also dependent on what communities you live in, then it's pretty much like not the best recommendation as a physician to tell people to do that. So making sure that we're inclusive of all abilities, all communities, and creating accessible bike lanes, sidewalks, et cetera. There have been some policy changes towards clean and active transportation. So in 2020, Governor Newsom signed an executive order which directed the state towards 100% zero emission vehicle sales by 2035. And in 2022, CARB adopted advanced clean cars to operationalize that goal, ramping up starting with model year 2026. So that's this year. There has been a lot of federal pushback, so this is an ongoing area of discussion. Next slide, please. And so what is the health benefit of clean and active transportation? So there was a study in 2018 finding that providing more ways to get around increases overall health, reduced elevated BMI and physical activity, and lower car-dependent counties saw lower BMI rates than the former. And then it also can cause improved health outcomes as a direct result of more transportation options. And then it's also, I wanted to talk about, Cindy had brought it up already about the air pollution cleanup in LA in 1960s. So in the 50s and 60s, ozone levels, and some folks might be very familiar with this, but in LA were 5 to 10 times higher than what's considered safe today. And these concentrations are some of the highest ever recorded in urban areas globally. Smog was so severe, you could sometimes only see like 3 blocks in front of you, and people had eye irritation, respiratory issues, and had to wear masks, goggles, et cetera. But through the years of policy work, advocacy, air quality today is much improved. So we can do it. I know we haven't directly talked about it, but there is always a changing political climate. I know that Kevin touched on it briefly at the beginning, but it is just something that is always underlying what we're talking about as we're talking about changing policies. Next slide, please. And as we talk about the transition to renewable energy and clean energy sources, it's also really important to talk about a just transition. I'm not sure how familiar folks are with the term just transition, but the ILO defines it as greening the economy in a way that is fair and inclusive as possible to everyone concerned, creating decent work opportunities and leaving no one behind. Um, I started my more formally environmental justice work in New Orleans, working with folks, the communities in Cancer Alley or the stretch of the Mississippi River between New Orleans and Baton Rouge, who experience really high level of pollution. Um, and when I started there, and then also coming to LA, a lot of times the communities who are impacted are kind of weighing like, yes, we're impacted in our but at the same time, some of these things are our jobs, like we rely on these industries. And so, how do we create a transition where we're providing folks with an economic opportunity while also protecting everyone's health? APEN is an awesome organization within California. They're the Asian Pacific Environmental Network. And they talk about just transition as a vision and framework for moving towards a world where everyone has the resources they need to live full, dignified lives. And some of the projects that they're working on are like Power to the Front Lines projects, which is growing locally produced and governed 100% clean renewable energy resources in neighborhoods that need it the most. Lower socioeconomic and working class communities of color that have been on the front lines of fighting big polluters. And then the city of LA has been talking about just transitions as well. And this is a article that they published. So just transition is required to protect workers and communities who depend on fossil fuel industries for their jobs and income. And it's a transformative path to a more equitable economy and society. Next slide, please. Um, and I also want to touch a little bit on changing energy use. This kind of goes back to the first slide we were talking about with the global maps, where it's impacting specific countries the most who emit the least, and then also the graph about like increasing energy use is also going along with increasing temperatures. So global energy demand continues to rise, as we saw in that previous graph. Clean energy still requires resource extraction, including mining, land use, and water use. So that can cause new environmental justice concerns. There is, let me go here. There's a high consumption lifestyle, especially in the countries that emit the most. The top 10% of global income earners are responsible for about 50% of emissions. And so it's really important to reduce excess energy consumption. And there's ways to do this in a way that like creates a more beautiful and just future. So next slide, please. Okay. And so now that we've been talking a lot, for folks who are in the audience, what excites you the most about these solutions? What does a healthy and just Los Angeles look like? This is something I've been thinking about a lot because we have a lot of like stories of the future that are dystopic. But what does it look like if we implement these solutions? If anyone listens to Dr. Ayana Elizabeth Johnson, she says like, what if we get it right? So if anyone wants to share, you can feel free to raise your hand or share in the chat about like what could this look like in LA? And I know we have a lot of experts from different fields here too, so feel free to jump in, add in anything that you'd like.
Do we want to do breakouts for this, Amanda, or should we keep in the group format? We do have
I
a
think we can,
few more minutes.
yeah, I think we can do maybe big group format if people feel good
Sounds
with that. Okay, cool. Anyone want to share?
I can share.
Thanks,
What
Nikki.
I think so. My name's Nikki Kluge. Kindling Communications is my consultancy. I work at the intersection of climate, energy, and public health on communication side of things. So, what excites me most is that the like opportunity to bring communities together and connect people in real life. I think because Los Angeles County is so, we're just sprawled. We're so far apart. And if we have some of these solutions kind of bringing us together in different ways, transportation, obviously, I'm a frequent new user of the Gold Line. Like that has really changed my life. And I know that is just helping me cut gas costs and pollution. And I love that. That gets me to my yoga studio, in a better way. And that connects me to community members. I get to more events now in downtown. So that's just the transportation side. But I think around, clean energy solutions like that in itself creates community and coalition type work. Maybe not coalition work, but we've got to all work together to make that happen because it's a big transition. It's a big leap to kind of change the status quo. So I'll just say that's what I'm excited about is bringing actual people together who are normally very spread apart, a little bit closer.
Amazing. Thank you so much for sharing, Nikki, and thanks for being here. That sounds super interesting. I'll follow up on that.
For hosting.
Awesome. Anyone else want to share? Oh yeah, go ahead,
Okay.
Allison. Oh, sorry, Nydia, go ahead. Sorry if I pronounced that correct.
Briefly, yes, that's correct. I work with the Governor's Office of Business and Economic Development, and I was actually helped write the LA Sustainability Plan that you shared in your presentation as an air quality advisor. I'm now working on a report that is focused specifically on zero emissions equity. So I think that the conversation needs to continue with always making sure that the voices of those most impacted, as you're mentioning, call it environmental justice, call it racial justice. I'm simply calling it equity, are the ones who talk and create the solutions that should help verse the policies that will improve the quality of life for all of us. So uh, that report should be coming out this summer and published in the fall. And it's the first zero emissions equity action plan for the state on agencies trying to continue to use equity in their transportation planning and in their just transition.
Wow, we have such cool folks here. Thank you so much for sharing. Wow, I'm really looking forward to that.
I'm glad to be here.
Yeah, thank you. Anyone else? Allison, I saw you had unmuted. Do you want to? Yeah, go ahead.
That sounds really great, Nydia. So I'm looking forward to reading that report. Um, yeah, I mean, I think about, I mean, I don't work directly on transportation issues, but I do think if LA County gets like public transportation right, that would be truly transformative. Um, I actually no longer live in LA County. I live in the Bay Area, and like the amount of public transportation I take now versus when I was in LA is like astronomically different. And and I don't even think the Bay Area is like that great at public transportation overall. So I'm like, if California, just in general, like as a state, if we can get public transportation, I think that would be so transformative. Because I even notice like the air quality up here is different um, when I come and visit and come for work. Just the congestion of the cars everywhere. I'm like, gosh, I had forgotten about how bad this can be. So I'm really looking forward to seeing at least like some conversations. I think, especially with like the Olympics coming, like transportation is like essential part of that. So I'm hoping that that investment can continue. Um,
Yes, thank you for sharing. Okay, anyone else have any thoughts? Yeah, go ahead, Cindy.
Hey, I just wanted to make a plug for the book, What If We Get It Right, by Ayanna Johnson. It is so inspiring and hopeful. And there are so many people that are already making a big difference in terms of what they're doing, and so many here on this call. So that inspires me as well. I think I want to make sure everyone is reminded that so much of our environmental policy is driven by our political leaders, and how important it is to vote and to get others to vote in the upcoming election, because it's so critical for choosing our leaders who will enact policies that understand what we're going through and responding to it. Yes.
Yes, thank you for uplifting that, Cindy. Actually, Dr. Ayanna Elizabeth Johnson, I think she's doing a book tour that's part of LA Climate Week, and she's been doing dance parties at different places and go and dress up as your favorite renewable energy solution. So if anyone is interested in that, I'm not sure if it already happened, but I was hearing about it. Okay, anyone else before we keep on going? Okay, perfect. Maybe we can, yes, awesome. Thank you.
Yeah, it was really interesting to hear all of your perspectives. And now we can kind of shift into understanding how we can use specifically health as a frame for clean energy solutions and understand how we can translate all of those into community advocacy. So, first of all, healthcare professionals are currently some of the most trusted voices. Um, although in recent times, studies, especially in the Journal for the American Medical Association, have shown that this trust is decreasing over time. So it was about 71% in April of 2020, and it's declined to about 40% in January of 2024. So we can use this trust to deliver important messages, especially when it relates to climate health. But it's also important for us to rebuild that trust and rebuild relationships with communities. And this is mainly done through advocacy and letting communities know and patients know that we care about issues that impact them the most and also listen to their guidance. And research also demonstrates that framing climate change as a health issue can also increase support for collective action, especially by making policy solutions a lot more compelling and helping people connect to them a lot more. We're seeing that a lot of times with people across the political spectrum, especially politicians, they end up caring more about solutions, especially when it comes to something that affects the health of them and their loved ones. So it's really important for us to frame a lot of these climate solutions across health so that it connects to a lot more people and shows that it can affect communities a lot more. And rather than speaking of uncertain future events and kind of making it seem like a more foreign issue, health framing helps us bring climate change close to home and making it a lot more short term, local, and personal.
Thanks, Mayuka. And then in line with what Mayuka was saying, and as well as framing climate health as something as that involves much of our health, and you can involve our communities, especially that Climate Health Now is doing, is mobilizing members of the health community to advocate for clean energy as a health solution, but also as something that is necessary for our long-term health. And so public comment can be submitted for formal periods on proposed policies, rules, or projects. And this helps us advocate for things virtually, but also there's ways for us to get involved in person. And even if you're not directly a member of the health community, just showing up at these rallies, at these town halls and events where policymakers can directly hear your opinions. For example, sometimes showing up to the California Air Resources Board meetings where you can provide your own comment as a community member can really help emphasize the importance of framing these issues as health problems. And we've also been involved in projects. Climate Health Now has been involved in projects on air district rules concerning the Bureau of Land Management and pushing back on new oil and gas drilling. Me, Amanda, and Mayuka met with the Senator Allen's office to actually convince one of the staffers to have Senator Allen sign on to the Bureau of Land Management's letter to the administrator to go back against this ruling, and just combining all of our community forces against these issues can definitely bring our community closer together and closer to climate health solutions. Next slide, please. All right, and there's lots of other ways to advocate as a health solution. For example, public speeches, letters to the editors, and op-eds, which Amanda has participated in many of those. And then other members of Climate Health Now have given speeches at events, given those op-eds as well as LTEs. Actually, Ashley's one of Ashley's op-eds is posted here on Cal Matters. You're more than welcome to read that as well. But we just like to emphasize that using your voice is a powerful tool to advance advocacy and create those solutions that'll eventually, down the line, affect millions of people. Next slide, please. And then there's also meeting with your electeds in person or virtually, as we mentioned before. Just recently, Climate Health Now members recently met with 13 of the California reps about the BLM's plan to open less than 1 million acres to new oil and gas drilling. But opposing that with our voice and showing up in person really shows our dedication again in opposition towards these kind of actions from the Bureau of Land Management. And so this really shows our collective power, our strength in community organizing, and something great that we love to highlight every time that we speak about Climate Health Now.
Yeah, perfect. So something too that I've been working on, because I know that a lot of folks who shared may not directly associate themselves with the healthcare community, but we've been also working on like cross-professional relationships because sometimes in the health movements, we're not necessarily involved directly with the climate movement. So if anyone has ideas about like how as physicians that we can help collaborate with you, especially as a community medicine fellow and a family physician, trying to like respond to the community needs is something that I've really been trying to focus on. And so that actually goes into like supporting local community organizations like Stand LA. I'm not sure if folks are familiar with them, but I love uplifting their work. They're a coalition of awesome organizations, community-based organizations in LA who are trying to get neighborhood oil drilling out of Los Angeles. And they've been doing fantastic work, and I support in whatever way I can. And then I love that Nikki had brought this up, but creating relationships in person too, in LA County. I know this is a virtual event, but it's so awesome to also have some of these community events. We hosted a Sunday event about transitioning to renewable resources, and we tried to focus on environmental justice and a just transition as well, with also a change in energy use. And that's actually Kevin speaking at that event as well. It was super fun. So we'll keep y'all posted if we have any other future in-person events. And then just being part of a community in order to make change together and experience joy in the movement. Something I've been thinking about a lot in movement spaces, like how do we sustain? There's a lot of heavy things going on in this world right now. And something that I learned from a lot of the community organizations and frontline communities, like being joyful in the movement as well as holding grief is what sustains us. And so thank you so much at being here as a small community and meeting some folks. And this is really awesome. And we also participate in rallies, potlucks, hikes, and much more. So next slide, please.
Oh, sorry. And these are a few action items and also opportunities to get more involved. So first, the South Coast Air Quality Management District is trying to pass two rules, 1146 and 1146.1, to have more zero emissions energy across California and across the South Coast. And they actually have a meeting today from 6 to 7 p.m. So if any of you are interested in joining and learning more about their movement, please do. It's really interesting. I've been involved in this campaign for the last few months, and they've been doing a lot of great work. And then I think Whitney's sharing it right now, so you guys just can RSVP and attend if interested. And then the other opportunity is the May Day Climate Justice and Workers' Rights March on May 1st. And I think a lot of interested people in Los Angeles are meeting at MacArthur Park on May 1st in the morning. So this is also a really great way to advocate for the climate locally.
And just a quick recap as we go through the slides again.
All right, we're back.
Thanks, Whitney. I think next slide, please.
Yes.
Cool, thanks, Mayukha. And then just as a little plug-in, we'd like to just formally announce if you'd like to join Climate Health Now as a member, even if you're not a member of the California health community, you're more than welcome to participate in our events. And then if you are a member of the health community, welcome. We'd love to have you. We also have a ton of events coming up related to advocacy and our goals for 2026 and how you can get involved in those. And it's just a great way to connect with other members of the health community and find your voice and when advocating for climate health. Next slide, please. And Amanda, if
and
you wanted
then
to
more,
talk about the new one. Yeah.
yeah, more personal plugs. I love that someone talked about media and communication. So I have a podcast called the Nuance of Community Health Podcast, and we talk a lot about environmental justice. And a lot of what I focus on is narrative justice. So I have like frontline community members come on or experts, and just trying to uplift stories that are not necessarily heard as often. So if you're interested, no pressure.
And me and Mayukha would just like to announce that we've been working on a project to combine those who are college age students, high school students, involving those sorts of populations with education related to climate health, environmental justice, as well as advocacy. This kind of serves as another arm of Climate Health Now's advocacy. So if you're interested in that, you can contact either one of us with more information. This is sort of a coalition of college age students working towards climate health as well as advocacy.
Yeah, and we'll put our emails in the chat if anyone does want to reach out.
Amazing. Perfect. Thank you, everyone. And then now we have about 7 minutes left. Feel free to take the 7 minutes to yourself, or if anyone has questions, thoughts, comments, thank you all so much for being here. We really appreciate it. And again, we're not experts in renewable energy solutions, but this is the basics of what we understand, and from a health perspective, how it impacts us. So always happy for feedback on what folks think who are working in that space as well. So thanks, everyone.
Great job. Thank you.
Thanks, Ashley.
Thank you so much. Yeah, I just
Well,
wanted to say thank you for having a conversation on climate health. I think it's definitely really important as someone who's gone to some of the LA Climate Week's events, but also San Francisco Climate Week. It's always great to see conversations like this. We need more of it. So thank you all.
And
Thank you,
Allison will
Allison.
also be at the San Francisco Climate Week doing a similar presentation, but more kind of San Francisco specific with some of our members in that area. So feel free to chime in for that one as well. It's actually a week from today.
I'm going to try and join. So thank you.
Awesome. Any last thoughts, or do we want to close it out?
I think we're good. Thank you, everyone, for coming. I appreciate it. And yeah, see you next time. Reach out for anything. Happy to connect. Thanks.